Hello, everyone. I'm Dr. Mehwish with you in the first part of this webinar. I have decided to cover the webinar in two parts. Why I have decided this? Because this is a very, very long topic and we have to cover this topic in two parts. The first part will be all about the anatomy of the female genital tract, and in the second part, we will try best to cover physiology and endocrinology. I would request everyone to keep a check on the mics. It would be best if there will be no interruption from the open mics of the students. And second thing which I want you to uh, keep in mind is that we have to be very careful while studying for post-graduation examination, guys. So we have to make an aim while starting reading anything. You are about to start any topic, you should have an aim in mind. What are you going to learn? So today's webinar and the thing that we are covering this way, anatomy, physiology, endocrinology of this same topic. Why we are doing this? We are doing this because we want to learn interlinking. Okay, we want to learn interlinking. What is interlinking? I want to tell you. If there is a topic like this is the similar one. We are now talking about female reproductive tract. There is GIT topic as well in the endocrinology, in the physiology, and in the anatomy. If you interlink the topics, you learn best. If you interlink the topics, you learn best. Hello, Dr. Zaib. Welcome in this webinar. How are you? And I'm very happy to see you here. Also, Walaikum Assalam, Dr. Misbah. Walaikum Assalam, Dr. Sadia, and Walaikum Assalam, Dr. Salma. Welcome in the session. Is my voice good? Screen is good for everyone? Walaikum Assalam, Dr. Naira. Okay, great. Because I was talking to Dr. Zaib and I believe she's not here. So we were talking about interlinking the subject. So you're learning something in the physiology, and if you don't use that knowledge in the anatomy or endocrinology, that's not a good way of learning. You have to use your knowledge by interlinking the similar subjects. Now, you also have to learn how to make your post-graduation examination prep easy. Now, tell me, guys, how many of you are just and only studying and not doing any other thing in the life? Is there any single student with me in this meeting who is studying this way? No one. I believe no one. If you are, even if you are unmarried and even if you don't have kids with you, you have a responsibility of your job. So there are very few examples for post-graduation examinations. No matter you are taking FCPS, no matter you are taking MRCOG, and no matter you are taking MSMD, post-graduation examinations are unlike the examination we used to attend in our college life. We don't have 24 hours for studies only. At that time, our parents used to say, don't do anything else, just study and study and study, and we don't want you to even attend the marriages of your relatives. So, what happens in post-graduation examination, you have to take care of a lot of things. And if you don't learn the smart study method, if you don't learn the smart study method, you will, there are highly chances that you fail the exam. So learn the smart study. Learn the smart study and interlink the topics. And if you are able to understand this very important thing that what you have to learn from the anatomy, what you have to learn from the physiology, and what you have to learn from the endocrinology for MRCOG 1 exam, You missed that time. Yes, Dr. Misbah, that time was very easy, and our parents are kind of blessings for us who used to make us sit in front of books all the day and all the night, and they never put any responsibility. But life changes after after you are graduate. When you become a doctor, you are responsible for a lot of things. And yes, for the females who are attending this exam mostly, the MR so all of you are very much in similar state that you all have responsibilities of kids. You are newlywed or you have very small kids with you. So you have to understand that smart study is the only technique by which you will attend the exam and clear the exam. So we will start the anatomy of the genital tract. We will quickly cover this topic and we will also look on the topics which you have to study tomorrow. Tomorrow, more likely, I will conduct the second part of the session. I will inform you in the study group. So, guys, we have female genital tract. We want to study female genital tract in two parts: external genitalia and internal genitalia. What are external genitalia? You know very well. We are just revising everything you have already in your mind, and this is already you already have a good knowledge about it, but we are just revising so that we can go towards the main purpose of this today's webinar. I will explain that in the later slides. So the vulva, it is the broad terminology. Vulva is the broad terminology for all external genitalia. Okay, vulva is the broad terminology. Guys, please take care of your mics. After joining the meeting, mute your mic and only open the mic when you have to ask a question. So you can have a look on this picture, on this image on the right side of the screen. You can see this is the pubic area, mons pubis, the hairy one. You have clitoris on the interior upper side. Then you have this bladder opening, urethra. Then you have this vaginal opening. Around these two openings, you have inner lips, or you can say labia minora. And around the labia minora, you have labia majora. Here you have Bartholin gland on the lower side of this labia minora. And this also has a duct. Then we have anus on the posterior side. So everything which is covered in this picture, broadly we call it vulva. We will discuss mons pubis, labia majora, minora, clitoris, Bartholin glands, etc. further. But before that, I want to tell you what are internal genitalia. Actually, I feel that on one side I'm teaching the topic and on the other side I'm muting the mic. So please, guys, take care of this thing. Don't open your mic. Vagina, cervix, uterus, fallopian tubes, and ovaries are the parts for internal genitalia. You can see this is the vaginal opening. Then we have vaginal canal. Then we have the cervical canal and for the whole cervix with internal and external os. Then we have endometrial canal of the uterus and the whole body of the uterus and the fundus. Then we have two things attached on both of the sides of the uterus, fallopian tubes and ovaries. We will read them in detail. And guys, these are the internal genitalia. Now, we used to study anatomy in very deep detail when we were graduating. I have told you the difference. You should understand that how a person was studying before and now what kind of study is required. So when you are graduated and you are now preparing for this exam, you are supposed to know everything about female reproductive organs, but still there are some very important details you have to pick and understand and memorize, and you can leave the very minor ones. You can easily leave the very minor ones. Especially, we are blessed with this thing that RCOG, they do not ask the roots of the blood vessels. the roots of the nerves, the roots of the lymph vessels, etc., etc. They only ask about very important and major things. So the slide you're looking at this time is actually covering all the important topics. So if you learn this slide about mons pubis, this is like you have covered everything. So firstly, you have to understand where mons pubis is located. So this is the mons pubis, this area, this like roughly triangular area, this mons pubis. You can see the hairy part, and you know the basic of this development of pubic hair. This is actually related to the endocrinology of the puberty. So we want to read what mons pubis is: a fatty, rounded area located anterior to the pubic symphysis. It becomes more prominent after puberty, and it has this fat deposit, and it is covered with pubic hair. What is the anatomy? It's located anterior to the pubic bone, composed of subcutaneous fat skin connective tissue. After puberty, it enlarges due to fat deposition and becomes more prominent. You have this external pudendal nerve supply and inferior epigastric nerve supply is ilioinguinal nerve and genitofemoral nerve, and superficial inguinal lymph nodes are the lymph nodes for drainage.
Ilioinguinal, genital femoral, superficial inguinal. Ilioinguinal, genital
Okay,
femoral, superficial.
cram, if you want to cram, please turn off the mics, guys. It's my request to turn off the mic. Dr. Menahil, you will not open your mic again, okay? Only open the mic if you want to ask a question. Further, we want to have a good concept about labia majora and minora. Firstly, the name itself is suggesting that majora is something which is big and minora is something which is, yes. You can use the chat box for answering minora, minor one, majora is the major one. Very good. So guys, these are folds of skin, or in very simple words, we can call them lips-like structures. So the outer fold is called labia majora. It's the bigger one, this one. Okay. And the inner one, inner lips are called as labia minora. Why they are made this way? They are protecting the openings of urethra and the vagina. Okay. This is the function of this structure. This is the function of this structure. Very easy if you revise this way. Very easy topic. What is the blood supply and nerve supply? Labia majora is pudendal artery. Labia minora, specifically, it's a branch of the pudendal artery, which is perineal artery. And here we have to understand the nerve supply very well. Actually, guys, the vulva, which is the broad terminology for external genital organs, they are divided in anterior and posterior parts. Okay, this is the division. Anterior and posterior parts. We are dividing this actually to understand the nerve supply of everything which is covered in vulva. So anteriorly, we have this yellow ilioinguinal nerve. Then we have this greenish one, genital branch of the genital femoral nerve. So anything which is um, coming under this anterior part, and that is mons pubis, right? Ilioinguinal and genital branch of genital femoral nerve. It is supplied by these two. And on the posterior side, guys, you have this posterior cutaneous nerve of thigh and pudendal nerve. More accurately, some structures are covered by perineal branch of the pudendal nerve. Okay. So if you remember this way, this diagram is very good and easy to understand this nerve supply. You can remember the nerve supply of all the parts of the vulva. Okay. Divide the vulva in anterior and posterior parts. Then for the anterior ones, you have ilioinguinal nerve and genital branch of the genitofemoral nerve, which are coming from the anterior side and covering these parts. Then we have posterior cutaneous nerve of thigh and from the pudendal nerve, we have perineal branch. This way, everything is covered. Is this clear? A lot of students are asking me in the messages or when they talk to me, they ask what kind of notes they can make for memorizing things. Guys, these are the notes. Okay? The slides I have made today are especially for this learning that how you will make the notes, how you will make the notes for you, how you will memorize the things. I will also provide notes, but cover important and unimportant all topics. Unimportant, you can say the minor topics from which they don't frequently ask questions. But in the notes, I will cover everything. The notes are part of your study plan, which is starting from 15th September. So anyone who has joined, he will get the note. And you will make your notes this way. Labia majora, blood supply, one word, pudendal artery. Labia minora, one word, perineal artery. And for your memory, you will write branch of the pudendal artery. So this way, only if you are habitual of making the notes. Actually, I'm not in favor of making notes for post-graduation exams. I want you to read and memorize and don't forget, which if you don't have this confidence in yourself that I will not forget this point till exam, because I believe that you can memorize everything till your exam day, but if you don't have this confidence, then make very short notes, very, very short notes. And these images are very helpful for learning the anatomy. Now we will talk about the clitoris. This is an erectile female genital organ at the anterior end of vulva, which contains numerous sensory nerve endings and it plays a major role in sexual arousal. What is the blood supply? Guys, why we are talking about this word pudendal a lot? Why? Who will answer? Uh, who has attended my anatomy class before? I have explained this thing. Let me have a look on the participants. I will remember who was the participant of the previous anatomy class. Mm-mm. Dr. Misbah, probably you attended the previous class. Okay, I will explain it again. Yes, recording of this webinar will be available. Yes, Dr. Misbah has got the question. Very good, Dr. Misbah. See, I told you that you guys can retain the information in your brains. If you make the concept, then you will not forget anything till exam. So you should have this confidence that if you have learned by making the concepts, you will never, never forget anything. Okay, my dear. Yes, you have attended my anatomy class before. So I focus on making the concepts. I focus on learning things with the help of images, and I focus on revisions. On the revisions, we will talk in the coming webinar. I will give you some tips and tricks for developing a good long memory about the subjects of Pharmacology 1, and then we will also talk how to solve the SPS. Right after the second part of this webinar, we will announce this one. Okay. So guys, pudendal. Pudendal for the nerve supply and for the blood supply. Pudendal word, keep it in mind. Okay. For the blood supply and for the nerve supply, keep this pudendal word in mind for perineum especially. If anything is in your perineum part, it will be supplied by pudendal, nerve, pudendal, artery. Okay, so we will talk about pudendal a lot. Nerve supply is again dorsal nerve of clitoris, which is again the branch of the pudendal nerve. And now I have an assignment for you guys. You will tell me the branches of the pudendal artery and the pudendal nerve in WhatsApp public group. which you have for discussion. We do daily discussions in WhatsApp group, and you all will send a message in the WhatsApp group by stating the names of branches of pudendal nerve and pudendal artery. Okay, this is an assignment for all of you. We provided 40% off to the participants of the previous study activity. I was very happy that many students got that discount offer as a gift from our team side. And I was very happy after seeing the participants. And it shows that you are serious about the studies. And again, if you are serious about taking exam, don't spend a lot of time in only thinking. Make it work, study for it, and then attend the exam and pass this part one and then move to part two. That's all. Guys, this is the internal anatomy of the clitoris. You can see a clitoral glands. Then we have the body, corpus cavernosum. Then we have the sclera, rest of the clitoris on the both side. Then the bulb of the vestibule. This is the whole anatomy of the clitoris. And you can see the relation of this clitoris with urinary meatus and vaginal opening here. And it is right anterior and above to the urinary meatus. Now we are talking about the vestibule. What is the literal meaning of the word vestibule? What is the literal meaning of the word vestibule? You can Google. You can Google the answer. See, we are learning here that how to develop a long-term memory. A long-term memory. So you have to understand that if there are words in English or words in Latin or words in any language, there are Latin and Greek and English language mainly for the anatomy. If you learn the meaning of the word, then you can remember that word and the definition and everything about that. Yes, Dr. Sophia has got the answer. Chamber. Chamber is the good word. Channel. Well done. So the chamber, the channel or opening to another thing is the good definition of the word vestibule. So if I say that we have a vestibule in the female reproductive tract and it is placed between two labia minora, and we call it vestibule because the literal meaning of vestibule is applied over here. Then you will say, okay, Dr. Mehwish, we remember that in this vestibule we have two openings as well. One is the urethral and one is the vaginal opening. Okay. If you learn this way, you will never forget the meaning, the two openings, and what is the definition. Definition is that this area between labia minora is called as vestibule. That's all. The area between labia minora is or in the vulva is called as vestibule. We will again revise because this is a past paper question. This is a past paper question and they only ask the definition. What is vestibule? And then they will give you five options and then you will pick this one. Area between labia minora is the vestibule. This is a smooth surface that begins superiorly just below the clitoris and ends inferiorly at the posterior commissures of the labia minora, contains the opening of the urethra and the vagina. Okay. Then guys, there is another area we call it as pudendal cleft, and this pudendal cleft area is between labia majora. Okay. So this is the difference between vestibule and pudendal cleft. Have you got this point? Can we move ahead? Yes, we can. Okay. Make sure Make sure you learn every slide. Make sure you learn every word by heart so that after we finish this webinar, you have a good understanding of the anatomy, and then we will apply this knowledge on the other part, which is the second part of the webinar, because this knowledge is very important. Okay. Now we have this Bartholin gland. Bartholin gland is a mentionable gland in learning the female anatomy because of its clinical significance. Whenever this Bartholin gland is blocked, we have Bartholin gland cyst. Whenever this duct is blocked, which is releasing the secretions into the vagina, we have Bartholin gland cyst, which is a problem, and we treat it surgically. Sometimes we treat it surgically, and sometimes it is manageable if it is not very much infected. So the Bartholin gland are two piece-sized compound alveolar gland located slightly posterior and to the left and right of the opening of the vagina. You can see in the picture as well. I have told you to use the images always for learning the anatomy. What is the function of this gland? They secrete mucus to lubricate the vagina. What is the blood supply? Again, pudendal artery. What is the nerve supply? Again, pudendal nerve. Very easy to understand and learn. So the vulva and the parts related to vulva are now done. We're done with this topic, and now we will start internal and genitalia. We will start reading the internal genitalia from vagina. Firstly, we will try having a good idea about the anatomy of the vagina. Vagina is a muscular canal lined with nerves and mucous membranes. It connects the uterus and cervix to the outside of the body, allowing the space for menstruation, intercourse, and childbirth. Guys, if you keep this concept with you, that whole purpose of making uterus, cervix, vagina, and actually the pelvic bone, which is surrounding all the pelvic organs, and the perineum, everything is made for this one purpose, childbirth. Okay, childbirth. We will read the physiology of menstruation and endocrinology of the menstruation and everything that will also be in favor of ovulation and fertilization and again childbirth. Okay, so the body of this female is constructed this way, it is regulated this way, and the hormones which are coming and acting on all these organs all are working in a way that they are serving a purpose. They are preparing the body for the childbirth. They are helping or assisting for this one phenomena, or you can say procedure. And everything is designed this way that if you keep this thing in mind, and you are reading the anatomy of the pelvic bone, which will be the part of your course. I have told you that it's starting from the 15th September. So if you're reading the pelvic bone and you learn that what is the difference between male and female pelvic bone, then you will also understand that everything is going towards one direction, childbirth. Okay, so keep this thing in mind and you will easily learn everything. Now, guys, this vagina has very easy blood supply, vaginal artery. Vaginal artery is coming from internal iliac artery. It has nerve supply, pelvic autonomic system, and sensory fibers from the pudendal nerve. Okay. The lymph drainage, I have got this lymph drainage from Snell's anatomy, which I think it's a good authentic source for taking anatomy points. So upper third of the vagina is coming, is draining itself into internal and external iliac nodes. Middle only in the internal iliac, and lower third is going towards the superficial inguinal nodes. Okay, very simple and easy notes so for you for learning the anatomy of vagina. Another important thing, I want to ask you one question before starting this topic. What is the significance of learning the relations of an organ? Like, if there is this particular thing we are studying right now, vagina, what is the significance of learning the anterior and posterior and superior and inferior boundaries? Exactly, Dr. Lishpa has quickly got my point. If you are and you are performing surgeries and you are exactly Dr. Sana, very good, Dr. Mispa. To perform the surgery, you should know another significance, Dr. Lilishpa, that if there is a disease, how it can spread. Very good. It can involve the adjacent or relevant organs. So this is also a significance extension of the disease. Very good. See, you are using your brain and you are learning very well. So for performing surgeries, it's very important to learn which structure is lying adjacent to the uterus, and for the other organs, yes, you should know. You should know the details. Now I want you to understand this thing that they sometimes ask very simple questions that what is the main artery supplying this organ? Always remember that RCOG loves to give you these kinds of questions. See, they know that you are OBS gynae specialist. They know that you are going to become OBS gynae specialist. And they know that you learn these topics and you can answer the questions. So how they make the exam difficult, they give you tricky questions. Okay, how they trick you like this. They will ask you a question with A, B, C, D, E options, and in the question they will ask that the blood supply of the vagina is coming from which main artery or main vessel. Okay, then they will give you in the options internal iliac and the vaginal and etc etc. Or they can ask you that vagina is supplied by the branch of which artery, the branch of which artery. Both ways the answer is different. If they ask you the this organ or especially the vagina is supplied by which branch of which artery, so you will say internal iliac. This will be the correct answer. But if they say that it is supplied by which main artery, then you will say vaginal artery. And if you don't read the statement of the question carefully, you can make a mistake. And you can make a mistake in a question which you have learned very well. So remember this thing that from very easy information and from the things you have learned very well, don't ever be, less attentive towards the statement of the question and don't make this mistake. So here, this is a very good, colorful, wonderful diagram, which is telling you that ovarian artery is different artery from uterine and vaginal. And then you have this very clear idea that uterine and vaginal are coming from the internal iliac arteries, but ovarian artery is coming from somewhere else. From where this ovarian or gonadal artery is coming? Can you tell me? Gonadal vessels are, yes, try thinking. And why I'm reading this word gonadal? Why I'm not saying ovarian? Why I'm not saying ovarian only? Yes, ovarian and testicular both very good, Dr. Relishpa. If there is a similarity between male and female, and if you remember it as a similarity, then you have covered both questions. So if you learn that gonadal branches are direct branches of aorta, direct branches of aorta. They are coming directly from aorta. And then if they ask you a question about the blood supply of the testes, you can answer. And if they ask you a question about the blood supply of the ovarian, you can answer. Very good. Same goes for the nerve supply, right? Nerve supply of the gonads. It's T10 for ovaries and testes both. Again, I'm telling you that the notes I will share in the classes, they will cover everything, so you don't have to worry about these important details. Let's start talking about the cervix now. So the cervix, you know that it is the, actually you can say this is the part of the uterus, the lowest most part of the uterus, but we study it different as a different, we don't study it as a different organ, but we study it as a pathway between vagina and uterus. Actually, this canal, this endometrial canal is having the way from this fallopian tube, then it's the endometrial canal, then it becomes the cervical canal, then it becomes the vaginal canal. Okay, so the secretions and everything which is here, it can have a way outside the body. Plus, this endocervical canal is very important because it has two doors. The internal door is called internal os and external os is called external os, and it's very important because again I've told you everything we are studying is made for one purpose, that is childbirth. So the cervix has a very important and very primary role in the childbirth, so we will study it this way. So the internal os is the opening between cervix and upper part of the uterus. Endocervix is the inner part of the cervix that form the endocervical canal. Ectocervix is the outer part of the cervix that opens into the vagina. And external os, the opening between the cervix and the vagina. They will definitely not give you this much easy questions in the exam, but if they can, you can easily solve. What is the blood supply? Blood supply is coming from the uterine and vaginal arteries, different branches, they supply to the cervix. Nerve supply is autonomic mainly, and lymph drainage is from internal and external eyelid nodes. Again, I'm emphasizing on this thing that make very simple notes. Don't try grabbing everything, every detail about the cervix, and don't try collecting a lot of unnecessary knowledge while preparing for this exam, because you should know what they can ask in exam, what they will not ask, so you can save time and put the energies in the right direction. Okay. Now we're going to talk about the uterus, guys. Again, we have divided the uterus into parts because we want to read the anatomy of an organ in a way that we learn easily and we retain the information also. So there is a fundus. Fundus is the uppermost part. Then we have this body of the uterus or to both sides of the endometrial canal. Isthmus of the uterus. Isthmus is connecting the cervix and the body of the uterus. Before talking further about this topic, I want you to understand something. Let me explain. We have this endometrial canal, and then we have body of the uterus. I have told you that canal is continuous towards the cervix and then vagina. Okay, but there are further parts inside the uterus. We say this canal is endometrium. Then we say the tissue part, the muscular part of the uterus is called as myometrium. And then we have perimetrium, or you can say serosa. It's very important to learn this part of this lecture because we will apply this knowledge on the physiology and endo part of this this discussion. Okay. So before going towards the physiology and endocrinology part, we are reading anatomy for a very important purpose. Now we know that uterus is supplied by the uterine artery. So uterine artery is giving branches It's not coming and showering the blood on the uterus. It's coming and giving branches in a way that the branches are mixing up in the all three parts of the uterus. The first part, which is endometrium, the second, which is myometrium, and the third or the outer lining is the serosa. So actually, this ovarian artery is only here because it is showing the anastomosis between uterine and ovarian artery, but you should focus on this uterine only. You can see that, okay, again, I want you to tell me the meaning of this word arcuate. What is the meaning of this word arcuate? Yes, arc like, very good, or bow like. So you can see that this artery has the name arcuate artery coming from the uterine because it is a the structure of this artery is this way. Then we have radial, and then we have basal arteries, and then we have spiral arteries. Exactly, these are the branches of the uterine artery, but they are having certain shapes. Spiral artery, you can see it's a spring-like structure. So you have to remember the names that in the endometrium you have spiral arteries, in the myometrium you have radial and arcuate are the ones who are giving these branches. Guys, you have to give me just 1 minute. Okay, I'm back.
C'è una parola?
I actually don't charge for the free webinars, but I will charge for muting the mics because this is kind of an extra work. So Dr. Mir Alam, please take care of the mic for next time. It should not be open this way. Okay. So if you're done with getting the concept of for this topic, guys, you have to understand this thing. Now we are talking about the endocrinology of
हाँ हाँ सुन लिया है मैंने
these two things, actually the anatomy of. You can see the epithelium of the uterus, epithelium of the endometrium, and it is formed this way. Then you have these endouterine gland secretions and the part of the gland, and these are the secretions going towards the endometrial canal. There will be another endometrial canal on the opposite side, sorry, endometrial lining on the opposite side, and this is the endometrial cavity between the two lines. Then you have to understand, guys, that this endometrium is having stratum basalis and stratum functionalis. Okay, basalis on the base, functionalis on the upper side. And I will ask this question in the second part of webinar to the participants that when you were learning about the anatomy, you remembered this way or not, because we will use this knowledge in understanding the physiology of menstruation. So this is very important. Okay, this is very important to learn. The basal arteries and the spiral arteries, these the coiled ones, we just learned about these because I wanted you to use that information here so you can see that how they are structured with the endometrial glands and how the endometrial cavity, sorry, the endometrium is designed. And we will read further that how this endometrium is going to take part in menstruation. So learn the two types of cells, or learn the two parts of the endometrium. Then learn that how myometrium is right behind the endometrium, and then this is the perimetrium, which is the serosa. Now we will go towards the uterus. We already learned that it has endometrium, myometrium, and serosa. We already learned that blood supply is uterine artery, which is the branch of the internal iliac artery. And in the exam, they specifically can ask that anterior division or posterior division of the internal iliac artery. So tell me, is this an anterior division or posterior division of internal iliac artery? What about uterine artery? Anterior, very good. Anterior division of internal iliac artery is giving you uterine artery. And you have to remember the branches of posterior and anterior division separately. Okay. What about nerve supply? It's sympathetic and parasympathetic, and para is coming from S2 to S4 segments from the sacral plexus, and sympathetic from uterovaginal plexus. Okay. Lymph drainage, we studied the fundus, body, and cervix differently because the lymph drainage is also different, so it will help. Lymph vessels from ovarian artery to the para-aortic nodes from the fundus, and body and cervix, they are drained into internal and external iliac nodes. Some lymph vessels pass through inguinal canal to superficial inguinal nodes. Okay, this is how lymph drainage will be covered.
वाह वाह, बगैर मेहनत के 23 बच्चे। बुलाते रहे तो जाना नहीं।
I'm deeply annoyed by this thing, but it's just it's not my hands that if anyone is joining that, then their mic will be off spontaneously, but I'm letting team know that they should take care of this thing. Okay. Now, guys, you have this very important diagram. If I mute the mics from my side, I have this option of muting everyone, and I think I should use that. Okay, guys. Guys, give me just 1 minute, please. Yes, doctors, I'm back and very sorry. Yes, I will give the notes. I will give the notes. Okay, Dr. Sophia. Uh, it's actually not a very entertaining show for whole family to watch. Yes, I muted the mic myself. I took a break because there was a task I was handling. Okay, Dr. Sadia. Yes, Dr. Sadia is saying if you're not serious in taking the class, don't open the mic and don't make others disturb. Yes, we have to, I'm reading the messages. We have to take care of this thing so that the meetings are serving the actual purpose, which is learning. Guys, now a very important thing. Keep in mind this is the anterior side and keep in mind this is the posterior side. Okay. Now you have to understand that on the both sides of the body of the uterus, we have anterior to posterior, this round ligament, then fallopian tube, then ovarian ligament. Ovarian ligament is serving this bridge, is working as this bridge between ovary and the uterus. Okay. And then between ovary and the side wall of the pelvis, we have infundibulopelvic ligament. All the ligaments with the definitions, with the attachments, with their actual purpose, we will study in the second part of the webinar, but you should have a good idea that what is the location or anatomical location of infundibulopelvic ligament and what is the anatomical location of ovarian ligament and what purpose they are serving. Okay, tube, you can see it's between the ovarian and the round ligament, and round ligament for MRCOG1. So you should keep the attachments in mind. Ligament is starting from the body of the, they are both different. Okay, Dr. Sophia, I got your point. Alishpa, which two things are different? Explain your question, please. Ovarian and infundibulopelvic. Yes, these are different ligaments at different positions. And we will read the contents of these ligaments also. Okay. So let's read about the ovaries now, and the next part will be about the fallopian tubes. So the anatomy of the ovaries, these are oval-shaped organs. These are organized having germ cells and somatic cells. What are the germ cells? We call them oocytes. And what are somatic cells? Which are actually there for the purpose of providing food to the oocytes, and they are receiving the FSH and LH signals from the body. So I have told you that we are reading physiology, anatomy, and neurology together. So you should have this thing in mind that somatic cells are serving the germ cells this way, that granulosa, theca, and stromal cells, they are receiving the signals from the secretion of anterior pituitary, which are FSH and LH. We call them gonadotrophins, and then they provide this germ cell the support that it will be released, and again the ovulation and fertilization. So we have divided the ovaries into three parts. Again, physiology is important here. Outer layer is like a capsule of the ovary and it has this germinal epithelium. Okay. Middle layer, we call it cortex and it has follicles. Inner layer is called as medulla and mainly it has blood vessels and lymph vessels. What is the blood supply? Ovarian artery, again a direct branch of the aorta. Nerve supplies from T10. Lymph drainage is from the para-aortic nodes. Okay. Now we're talking about the fallopian tubes. You can see we have four parts of the fallopian tubes. I'm reading the question. Uterus has two ligaments or one. I thought two, one. Dr. Sadia, uh, actually, you should keep in mind, actually, you will tell me that how uterus is holding its position in the body. How uterus is holding its position into the body.
Inverted.
Yes,
Inverted, na?
Rabia, stem your mic. Yes, Dr. Sadia. Okay, I'm giving you options. Through ligaments. Okay, you don't have any bone. You don't have any bone, any bony structure attached to the uterus and the cervix. You don't have any bony structure directly attached to the uterus and the cervix. But they have to keep a position, a very strong position in the body. They are serving for the purpose of childbirth and they have this potential of okay, you are giving the names of ligaments, but I will specifically mention which ligaments are related to uterus. We will discuss in the coming slide. Very good. Not the sacroiliac, Dr. Sana. Sacroiliac is for the pelvic bone. Okay, let's open this slide first. Ligaments of the uterus. If you consider this cervix a part of the uterus, you have this anterior side and you have this posterior side. These are actually the main supporting ligaments of the uterus and the cervix. One is the pubocervical, second is the transverse or cardinal, third is the uterosacral. Uterus is receiving the support from all the sides, from the anterior side, from the lateral side, from the posterior side. From the posterior side, it has the support from uterosacral ligament. On the lateral side, the support is from the transverse cardinal ligament, and on the anterior side, the support is coming from the pubocervical ligament. The broad ligament, the broad ligament is actually not providing major support to the uterus. Major support is coming from these three. Okay, and this one is the most important one. This cardinal ligament is most important in providing support to the uterus and the cervix. Okay, so you can't say that one is the uterine ligament or two or three. You should know which is serving what purpose. Which ligament is serving what purpose. Exactly, uterus is a hanging organ and it is getting the support from the ligaments. It is not directly attached to any bone in the body. It is having the support from the ligaments only. Now we will talk about the parts of the fallopian tube. We have isthmus, we have ampulla, infundibulum, and the fimbriae. Isthmus is the narrowest part. This is the past paper question also. All the parts are designed again this way that they provide the pathway to the ovum. Provide the pathway to the ovum, which is going towards this part here, the fertilization, and then it goes to the uterine cavity or the endometrial canal for the implantation. The fallopian tubes are bilateral conduits between the ovaries and the uterus. In the female pelvis, they function as channels for oocyte transport and fertilization. What is the blood supply? Receiving the blood supply from ovarian arteries, because ovary is right adjacent to these tubes, and then ascending branches of the uterine. Sensory fibers from T11 and T12 are giving the nerve supply to these, and para-aortic nodes is the blood supply. Sorry, lymphatic drainage. Okay. All the students who are joining the meeting after half is done, they are advised to take the recording from the admin team and play the recording, because this is very important that you learn everything from this part 1 of the webinar, and then we will use this knowledge in the part 2 of the webinar. Guys, the thing I was talking about is round ligament, and tell me the insertion or the attachment of the round ligament. Yes, insertion or the attachment of the round ligament starting from the uterus and going towards labia majora. Very good, Dr. Sana, very good. So this round ligament, it is starting from uterus and it is merging itself, blending itself into the labia majora. Okay. The important points about the broad ligaments are here. Again, I will tell you that this is the two-layered fold of the peritoneum that extend from the side of the uterus to the pelvic floor. Just a minute, please. And the lateral walls of the pelvis inferiorly and adnexa superiorly. It helps to hold the uterus in anatomic position, but contribution is not considered to be central. It's not the only thing which is providing support to the uterus. Okay? It's not the primary support of the uterus. It doesn't have a lot of role in providing the support in that meaning that if broad ligament is not performing its function, they will be prolapse. But if other ligaments, they are not performing their functions, or they are weakened, or they are not, um, they're not strong, they will cause what? Yes, prolapse. Very good, prolapse. They will cause prolapse. Attachment, Dr. Seher, very good, correct answer. The most important thing is about broad ligament, which they ask in exam also, is the contents. So to learn today that ovaries, ovarian and round ligament, ovarian, uterine arteries and veins, these are the parts of the uterus. Sorry for writing this ureters here. Ureters are not part of the broad ligament. Okay, ureter is not the part of the broad ligament. I will correct this. I will correct this mistake. So guys, this is all about today's session. It's corrected now. What we were going to learn in part 2 of the session, we will read the details of the pelvic ligament. We will also read physiology plus endocrinology of the menstruation, and we will also read the physiology and endocrinology of the ovaries and the follicles and the endometrium. So keep in mind that you have to remember everything we have studied today, and we will use this knowledge in the part 2 of the session. We will read this way that we will relate the things. We will relate the things in a way that if something is happening in the ovary, what is the effect of this procedure on the endometrium, and how ovaries are stimulated to perform this procedure. What is the role of hormones, pituitary hormones and ovarian hormones on the body. So remember that again, you have to be very attentive in learning and attending this second part of the webinar. I will announce the date and the timing soon. All right, I can share this PDF with you. Okay, Dr. Sophia, I will share the PDF in the study room. No problem. Yes, Miss Ba, it's the retroperitoneal, not after coming into the pelvis. I know you're talking about the ureter, But after coming into it, this is actually the whole different topic. The pathway of the ureter we will discuss in the urology. All right, guys, thank you so much for attending today's webinar. Wait for the second part and we will meet soon. Thank you, everyone. I just wish you have learned well, and I just wish you have understood this thing that how you have to prepare for MRCOG1. Thank you, everyone. Quite soon, tomorrow, or most probably the day after tomorrow, we will conduct the second part. Thank you, Dr. Bushra. See you guys. Bye bye.